They're going to explain what it is, why they've joined a cooperative, how it works. And for that, we have Elisa Peredo, a member of the Maitelan cooperative. And I would like to thank them in particular for coming here, all the people that make up Maitelan, because many of us don't work on Saturdays, but care workers make no distinction between weekends, holidays, and regular weekdays. So when somebody comes to a meeting like this, somebody else has to take over that care. So thank you very much for coming. Thank you very much for the invitation. We're very pleased to be here, and we hope to contribute our experience and also speak for our colleagues that haven't been able to come. Why did we want to improve our working conditions? Since care work is characterized by being undervalued in spite of being an essential job, as mentioned earlier. Carers often face precarious working conditions and limited labour rights with long working hours, especially those that work in the special domestic service regimen. There's a long-term delegation of the responsibility of caring for people with health problems without the necessary rest, support and safety equipment in homes that aren't suitable for caring for a patient that produces chronic stress. Physical, mental and emotional strength is needed, as well as other qualities and skills. In Spain and in the Basque Country, there are many migrant women, and especially those that find themselves in an irregular situation that work 22 hours a day. According to the care agreement in the country, the maximum in Spain would be 7 hours per day in the care sector, 150 hours a month. But under the special domestic service regimen, which exploits many workers and many work as many as 400 hours a month. And we see that the profile of employers is not just the upper class as it used to be. There are many people from the lower and middle classes that don't just want to hire somebody to do the basic housework, but also to cover very special needs in the health and social area, to care for people with health problems, with dementia, with severe dependence. But to solve this, they hire somebody, preferably without papers. Up to 90% of the workers work under these conditions, working under the minimum wage, working longer hours. They know that they're being mistreated, but they have the Aliens Act to be afraid of. Many women take care of people with a high dependence and pick up too much weight to transfer them. And this is causing impressive health problems, since they don't have the training and don't have the help or transference or safety equipment. And many homes are not suitable to care for a person with dependence. And nobody advises the families to provide equipment such as cranes. And this can lead to health problems that may prevent them from providing proper care and cause deterioration in health at an early age. In the group of women we belong to, the AMET, the Multicultural Association, we felt the need to do something to change these poor working conditions, and especially for those that worked under the special domestic service regimen. Since 2018, we've been trying to improve the conditions led by a migrant woman, and together with the drive from the technicians in the district that obtained funding from the provincial council. And this gave us the motivation to work Saturday after Saturday during the year to set up the Maitelan cooperative in 2020. It's an integral cooperative. An integral cooperative, a non-profit-making social initiative focused on care, made up of three kinds of partners: the collaborating partners, the user partners, and the worker partners. We currently have 69 partners and 16 workers at Maitelan, although not all of us have 100% work contracts. Our goal is to obtain a two-directional social gain, providing quality systems based on people and mutual respect. We are also an instrument to make the care workers work dignified, improving working conditions with better contributions for our pensions and working hours that we can balance with our family life. Our social goal is also to regularize women that are in an irregular situation. For us, the relationship between the cooperative partners and workers with the users is very important. We currently work with 85 users, and by working under better conditions, we provide a better service. Our work is closer, more respectful, and implements methodologies to improve care quality in the care of each user. We adapt the daily routines to the physical and mental status of each patient, so that they will be able to increase their self-esteem and autonomy, and help them reduce the frustration they feel because of their physical deterioration. We feel that this way the person that is cared for will feel more active, and this is the best form of prevention for a good mood that will improve their health. We have found this also by working on other kinds of programs, and it's essential for people to feel safe, more active, and to also maintain their skills. And often we say, I don't know how to cook, so that they will pull out their cooking skills. Those of the work at Maitelan have a level 2 certificate, so that the people we care for can obtain the benefits. For people over 65, they're free from VAT. We also do cleaning work to supplement the working hours of the assistants, since the care sector requires working during the same hours as the cleaning workers.
Tenemos una relación.
We are also cooperating with different institutions and different organizations. As this is a social cooperative, in the tertiary sector we have users who are partners, and we also have cooperative members who are our users, and we provide them with services. And we also have connections with the rest of the cooperatives and associations, and with them we share this space at Maitelan, where we coordinate the care services that are provided for people at home. So in a way, this allows us to feel as if we form part of a community. And then we are also in connection with the Hernani Town Council. We have a very close connection, and also with the Berteri Burrunta area. We've also initiated a relationship. So this institutional support has been one of the key elements in the creation process, and which has allowed Maitelan to survive. Having formed part of the women's group of Hernani, which is a multicultural association, and together with the support that has been provided by the technicians of Beterdi that obtained the funding, well, thanks to that support, we have been able to set up Maitelan. And we currently have a connection with the Hernani Town Council, and as I mentioned before, they provide us with the premises where we have our offices as well as our headquarters, and that's where we coordinate all the services. Having this space is really very helpful, and it also gives us economic respite. We've also taken into account that we've had collaborative partners who have been very committed, and this has been vital for us to operate under the Maitelan umbrella, because many people didn't believe in Maitelan. They were the people that worked with us for many, many hours and supported us. And our close connection with the Hernani Town Council has allowed us to work for 4 years in a program that is very special. Together with another cooperative, we've had the opportunity of receiving lots of socio-educational support, and with 50% of the working hours that have been dedicated to training, especially in whatever had to do with the Basque language. Unfortunately, this program ended in the year 2025. Since October of 2025, we are now working on a new program with the assistance of Beterri Burunta, and this is a support program for migrant women who are working as carers and who live in the area, because what we want to do is set up a network of professional carers. That's the ultimate goal. And we also want to set up a collaborative network in the area so that we can provide them with the necessary support. And we will be providing them with information on the resources that are offered by each town council throughout the entire area, and we will also assist them so that they can receive social and sanitary training and improve their conditions, their employability, by organizing workshops and encounters. Well, this is the support that we are providing for migrant women who do not have residence permits and who are in a more vulnerable situation, and we think that we'd be able to cooperate much more closely with them. And for these years, we've been operating in different places with migrant women who got in touch with us because they wanted to set up a cooperative, but as they did not have any institutional support, they've not been able to carry on with their projects, to continue with their projects. So this is why it is absolutely necessary to have specific public policies as well as institutional support that serves to boost these social projects to achieve the same goals that Maitelan has, that are very important. It would be very beneficial for there to be a cooperative operating in each area. In other words, a group of cooperatives could address the problems related to the care sector, and we could ask for the subcontracting of services through companies that are making money through the workers. And we'd be able to leave certain organizations outside of this area by implementing changes that will implement much better conditions in terms of the quality of the services and of the jobs themselves by improving working conditions. And the care that we want to place in the very center are now on the periphery. They have been relegated and underestimated, but it is absolutely essential for these cooperatives to be able to have enough public resources and enough strategic support, because care is a very important issue. And we think that at these social cooperatives, it would be possible for us to work on relevant issues like the redistribution of care work in a much better manner. And we could also promote the social and political recognition of the work that is done by carers. And we could also have awareness-raising campaigns on the rights of workers, and also have a much more fair distribution of care work between men and women within families, and this could also be a public and collective responsibility. So this has to do with what we call the co-responsibility element. We have to involve the community, our friends and our family members, so that we can set up a support network that does not only focus on a single individual, which is what is happening right now, and implementing measures to care for people that provide care by offering resources in order to avoid any health problems, and also provide them with access to psychological assistance and physiotherapy. Social and political recognition. So it's crucial for society to recognize care work as one of the fundamental social pillars and not as just an invisible domestic chore or task. We have to boost
impulsar la creación.
We have to, as I was saying, we have to set up a public community care system, and we must all try to agree to the necessary clauses so that we can carry this out and eventually approve a national collective agreement for care workers, because right now we are covered by a Spanish agreement. So it's fundamental to fight to get decent working hours and decent money. We need more inspections to be performed, and we have to tell families that there has to be a relationship of dignity and respect, and we need to improve the working conditions too. And care is a very valuable element, because this is something that provides support for people's daily lives and for the well-being of people. And there's lots of social hypocrisy, and there's an incoherence between what is being done and what is said. And there's a minimum degree of social recognition, which means that there's more inequality and more precariousness. And as there's no social or economic validation, this maintains a completely system that is absolutely unequal. It's based on inequality. But right now, and at Maitelan, and in order to become collaborative partners and users, well, you can. All you have to do is go to the website and you register there. You can send in your applications, and if you want to become a collaborator or a user partner, you can do so on a private basis or on a company, a representative company. This is then sent to the board, and the board studies and decides whether the application is pertinent or not. And once approved, you are told how much you have to pay. You can find all the information on our website. And to become a worker and partner, well, firstly, you have to be hired by somebody, and you first have to undergo a test so that you can actually prove that you are working properly and that you are fully integrated in the system. And this takes between 6 months and 2 years. And those that are interested in hiring our services, well, all you have to do is write us and asking us for an estimate. And in the case of these potential users, well, what we do is we send them an estimate, and once they accept these estimates or these budgets, we then prepare all the documents, the contract and all the certificates that have to be submitted for these users can receive these benefits, this home care. Well, we want to dignify all of this work. We don't accept services lasting less than 2 hours because this affects the users. And right now we are managing to implement much better working conditions because we are working for ourselves. And we don't have an employer. We don't have somebody who's making money off our work. And we are registered with the Social Security. We pay our money into the Social Security so that we can have a decent retirement. And the wages are higher than what has been established in the Spanish collective agreement. So since 2024, by working longer hours, we now can include travel in the working hours. So in other words, the amount of time it takes us to go from one house or one home to another is considered to be working time. So we've also achieved a higher level of recognition of our workers by providing lots of training. We are becoming increasingly empowered, and we have now tools to address racial discriminations and age discriminations and sexual discrimination too. So we are also implementing self-care measures because we many times forget about looking after ourselves and we forget about our well-being to prevent health issues that will stop us from helping people adequately, and we have to avoid worsening our health at an early age. This is very demanding work, and at Maitelan we are providing self-care and psychological courses, and we've also done things in the area of physical self-care. We're trying to set up an efficient group, which is sometimes difficult because the kind of work that is done and the working hours are very variable. And we are also trying to exert some political influence because we are trying to make visible what people don't want to see. Thank you very much for listening to me. Well, thank you very much, Elisa. That was very good. I know that there are some people representing the municipalities or people that work in the area of politics, and I hope that you've taken all the necessary notes because you've given us plenty of information here this morning. And we have another speaker coming up now, Jasone, who's from the social services in Arrasate in Mondragon, and she's going to present a care project. It's the provincial council that is in charge of providing care, but it's also true that the town councils, well, this is the political institution that is closer to our citizens. They also have to do something about the demands that are related to the care system. And they are the people that have to implement these policies too. And one of the examples is the one that is about to be described now by Jasone. And the project is called ZainSare. And these are the municipal policies that could perhaps serve as an inspiration for other town councils. Anyway, good afternoon. And as we are extending these spaces quite a lot, we're stretching them quite a lot, and it might not be enough time later on to address all of the issues that are being pointed out here. What I'm going to do, I'm going to try to summarize what I'd prepared for this presentation, and I'm going to be talking about the new space that we have set into motion at the Mondragon Town Council. Because this is an issue that I believe contains many, many features. And what I'm going to be dwelling on is the issue that has to do with employment, with jobs. But let's say that our intention is to obviously extend the scope of action, although we are in the very early stages of the process, because we're talking about what we call the ZainSare, which in Spanish would be care network. What I have to say is that this plan was already it was born in 2023. It's covered by the 2023-2027 plan. And the authorities wanted to set up an employment office for carers in order to meet this social requirement, something that had to be looked into, especially to improve the quality of the services that were to be offered to people at home. And also something a little bit more extensive, like improving the working conditions of the workers themselves. So it was initially decided to address this from the angle of employment, and the Department of Employment of our town council was asked to draft a project together with the rest of the municipal social services and together with the Department of Equality too. And then in 2024, people started to work on this to define the contents of this service. And as we usually say, it's useless to invent what has already been invented. So that's why we focused on other experiences that were underway in other areas, in other towns and cities, to discover models that could serve as an inspiration for us to implement their experience in our own town. And that's when we saw the Etxeko Lan project from Warsaw in the province of Gipuzkoa in the Basque region. To start to define the service that we wanted to implement. And based on this model, this Etxeko Lan model, we performed an initial analysis of the care services that were already being provided to people at their homes in Mondragon. And first, what we did was draw a map of the care that was being offered in our locality, in our town, based on work that had already been done by the feminist movement of our town. So this was not something that we did on our own, but rather it was something that we did with the assistance of the feminist movement. And I have to say that I'm a member of the feminist movement too, and which meant that I knew about its reality based on the work that I'd done with these people for so many years. And a short time later, we developed a picture of what care looked like in Mondragon Arrasate. And that's when we moved on to the definition of new services that we wanted to implement. And in this first stage, we worked with a number of people and companies that were specializing in this issue. And in June, we were going to be shown a project, and in fact, a project was submitted to the town council by some companies. And this is where this pilot project appeared, that is called ZainSare, or Care Network in English. What we wanted to do is make carers professional and also protect and promote their rights as workers. This project was supported by SSI, a group of companies that specialize in the area of care, and was also supported by the Basque government. They gave us a subsidy to implement this pilot project. One was set up for Ermo and another one for Amurrio in the province of Álava. And in this regard, what has to be said is that we're talking about 3 town councils with completely different characteristics, and also with governing teams of a different political trend. And I think that people did things in a very, very responsible manner. And we can And now see what goal had been set to carry out this initiative. Well, the first thing was to improve the quality of the care service or the home care that is provided by focusing on professionalizing or making the workers much more professional, and also on the quality of the job, including the workers in this sector and the people that employed them privately. Because sometimes we families, well, the families are not aware of the fact, well, that families are also a very important element in this system. And we only remember this when the time comes to look after somebody or being looked after ourselves. But this is not the case, of course. This is not so, because it's obviously clear that we form part of this system in all of the stages of our lives. And I'm saying this because it is true that in this process, or in this project, or in most of the project, what we have managed to do is we've done some wonderful work with these people, with these carers. We've had some magnificent feedback, and we've also achieved a very high degree of professional training, and also we've been thanked by people because they've been listened to. And in the case of the families themselves have also been very happy with the process. So this is a space that is not only related to the employees, but also the employers, because what is very clear in our minds is that the carers know what their function is supposed to be from the very beginning. And they have very clear in their minds too what their obligations are like or what their role is like, but sometimes they're not aware of what their rights are or where they can go when these rights are infringed. And this is another of the goals that we set ourselves. And then on the other hand, and in the case of family members and employers, well, they need to know the rights and the obligations that they have. Because sometimes they say, look, I didn't know this, that, or the other. Well, look, no, it's going to be very clear for you from now onwards. And this is another very relevant issue too. So it's a space where you can share, where everybody can share, all the parties involved can share, where you can share your concerns and where you can share the problems. And this is what we want to do. This is what to achieve. And for that we are offering training to achieve a higher degree of specialization and professionalization, but also in terms of self-care. We have to provide training. We have to inform people on laws that apply to immigrants, for instance. And I'm saying this because perhaps this morning, I'm not sure if we didn't actually mention, we didn't really say who these people are exactly. I don't know, but at least in any case in Arrasate, Mondragon, we know who provides the care. And these are normally immigrant women. They obviously have their rights that have to be respected. And there is an immigration bill which is a threat for them. And sometimes it's an issue that we forget about completely. So when we need their work, it's something that we have to take into account. We mustn't forget that subject. And in this space, we also have the possibility of providing information and advice on subjects of this kind. And I know that there are many things that I haven't mentioned, but there's something that's extremely important and I would like to include here. And that is that this is not only about providing a number of resources for people that have certain needs. No, this is a network. Because to set all of this up, well, firstly, what we had to do was get in touch with other stakeholders, with other agents. It's not only about, opening an office and off you go. No, it's not that. Because first, we've done some work, some previous work, where we got in touch with many, many people from our town to see what kind of needs there are and see what had to be done, the services to be offered, and then set up a group. and start to cooperate. So we meet up every fortnight or so, every 15 days, to clarify doubts and to try to solve these issues so that we can make new proposals and new contributions. And I believe that it's a very interesting network that works with the help of SOS Racismo and with the assistance of feminist groups and with a number of schools that also are providing training. And there's another important thing that I wouldn't want to forget, and well, it is a very relevant issue. And I'm sorry if I forget anything, because there are things that we never talk about. We have the Association of Muslim Women or South American Women, who have Caritas and BIA, which is a charity, and the workers in a number of municipal departments, and also we have the Department for Community Development that have also provided us with lots of orientation, the training centers, and Academia Bastida, and the Arismendi Institution, and many, many other organizations. And the truth is that there are more and more organizations that are joining this space. It's a starting point. It's a very solid starting point, and we only hope that progressively we will manage to encourage more people to join so that they can become engaged in the process. And I think that each will do whatever they can, and I'm sorry for speaking so quickly, but I've finished with this.
Eskerrik asko, Jasone. Zure hitzaldiagatik, eman dituzune klabe guztiengatik ere bai, eta nik proposamen bat.
Thank you for all your comments and for the proposals. In the case of Arrasate and Mondragon, I don't know whether you could call it Arrasare, which is a play on words, Arrasare and Sare, which is network. Well, let's move on to the final presentation. We're running half an hour late, so I don't want to put any pressure on anyone.
Euskal Herriko Unibertsitatera, egin behar ere bai propaganda pixkat.
So I don't want to pressure anybody, and that is, I don't want to pressure the University of the Basque Country, that is. And, well, we have Ana Izagirre from the University of the Basque Country. She has a degree in sociology and social work, and she forms part of the Parte Hartuz task force that analyzes the interface between democracy and citizens' participation. Anna is the first expert that accepted the invitation to come here today. And, well, she's at the end of the list. But Anna has worked a lot in the area of work-life balance, and she's analyzed the internal coordination of the Basque system of social services. And she's also helped me coordinate this event today, or at least she has been the source of some of the main ideas that we've been talking about here. And she's also focused on equality in the area of home care. And we also sent her to Germany. And Anna is going to be talking about the importance of universal care and what we lose when we lose that. And I've left it until the end because I think that we should all leave this room but knowing what universal care is all about, how it affects us, and where we will stand as individuals and as a society if we don't have that kind of support, if we don't have that here. So thank you very much. Annie, thank you very much. Well, look, I'm going to speak closer to the microphone. Well, how much time have I got? Please tell me the truth. 15 minutes for this. All right. Well, and we'll put the timer on, please, so that I can keep an eye on the amount of time that goes by. And just let me know when my time is up. I don't know what to say because so many things have already been mentioned here. I mean, we've been very generic, but we've also been very specific. So I think that you've just destroyed my entire presentation. So what I'm going to try to do is deliver a very brief summary and add some brushstrokes of things that have already been said. And my presentation, let's say, has to do with a stay in Sweden in 2024. I was working on my doctoral thesis on social services, and more in particular on the social services that are offered on a daily basis to people with dependence. When I went to Sweden, my purpose was to get to know the Swedish system and to identify the debates in the area of social service in Sweden. And I think that when we go abroad, we are also offered the possibility of analysing things from a different angle. So when I arrived in Sweden, I came across a debate that I didn't expect, a completely new concept, and that is de-universalization, if you can use that term. And I thought that based on what was happening at that point in time, I would find exactly the opposite. Or perhaps that what I would find is a universality that had to be revised, but I didn't think that things had progressed that much. And I saw that there were researchers that were already giving practical examples. And I've read the papers by Dine, and she's listening to me, but the thing is it's somewhat depressing. But anyway, and when I went there, I came across this concept of de-universalization, and some questions came to my mind. So what does this mean? What does universalization mean? And what's happening for a country that has been a reference for us? Why is it that they are dismantling this system? Because now they're going backwards, and we were supposed to be progressing with this concept. But how is it possible to link this universalization with something that can be seen in both contexts? In other words, it's an organization that is de-universal. And in Sweden, the town councils have lots of autonomy, and these town councils are in charge of providing public services for the citizens. So this principle of de-universalization is a very outstanding issue that has always been a big concern for them, because the fact of guaranteeing homogeneity in the end was based on heterogeneity. And back in the 90s, what they did was initiate a reflection process, because, well, it was 1,500 municipalities with 10 million people. And subsequent to that reflection process, what they did was join or link the smaller municipalities to the bigger municipalities, and they managed to reduce inequalities between municipalities. And this is something that I connected to the Basque context, because there's not very many people here. But we have lots of municipalities that are very diverse. So what I saw then, I saw that yes, that this inequalities are various, but we also have similarities with Sweden, don't we? And we saw that this issue had been addressed, but from completely different angles. When I arrived there, and what I've focused on the logical approach to public services. That's what they were using, because it's always said that there's a culture of trust. And when I went there, and a professor said to me that there's something they call ticket, I think she said, which is a concept that would be something like safety or security, but not physical safety, of feeling physically safe, but rather a feeling that we have a good quality of life. In other words, that everything is calm, that there's stability, and the fact that if we have a need, this need is going to be satisfied because society has that responsibility. And I believe that it was interesting to understand that from a collective point of view, because at the end of the day, we're talking about a system that is sustained or supported by taxpayers. But this is how you can maintain independence, because without the collectivity, individually, we can never become autonomous and independent. And I think that it's an interesting thing, too, to be able to understand their logic, the logic they applied in Sweden. And as I said before, this is also associated with universality, because just because you're a citizen, you know that you're going to have a network that is going to support you or sustain you. But what is universality? What do they talk about? Or what do they mean? And there's an author that said that behind social policies, there always has to be the concept of redistribution. And Dine said that, as occurs with other authors, that this is something that had to be funded by everybody and has to be used by everybody, which gives legitimacy to that system, because if not, what will happen is what somebody mentioned previously. So in other words, it's going to be a service that can only be offered to certain people, but not to others. So that means that legitimacy is lost, and this is what weakens the system. But certain conditions have to be met. Let's see if I can pronounce this properly. The surnames Gabriel Marimarte Salvajelle. I don't know if I've said the name properly, but anyway, just let me know if I didn't. But the thing is that what they did was establish 6 conditions that I believe are extremely interesting, because they've been mentioned on quite a few occasions. Firstly, rights have to be recognized, and it has to be the same thing for everybody. But the interesting thing in this case, and that they pointed out, is that these rights must have something supporting them. But how should we interpret those rights? Because if it's a very generic kind of approach, it means that we're going to be focusing much more on universality. But if we have a very specific kind of interpretation, we're going to be reducing that universality. So based on that particular approach, if we leave people outside, if we exclude certain people, these needs are going to have to be met in some other way. And this has already been mentioned here. So the need doesn't disappear. It just moves into some other sphere and then involves the market or the families or whatever. And we also know that this also is going to produce harm for people. We know who the affected people are, so what are we going to do about it? And secondly, funding is provided through taxation. So that's how we can guarantee that people belonging to different social classes can receive the same kind of support. And in relation to this, well, this has to be top quality support. And this is something that has been mentioned, because if you do offer something that is top quality, well, even those that can afford to pay for that are going to go for the public option. So this gives legitimacy to this kind of care, or this kind of support that is offered. And then on the other hand, I dare say that another of the conditions is that in the case of citizens that have more pressing needs, or citizens that consider that they could become potential users of those services, eventually become users, because those that do not use them could always opt for other pathways. And then the 5th and 6th principles would be the following. I think that they are somewhat more new, well, they were in my case. And firstly, it was said that for citizens, there have to be uniform rules for everybody. And because all this business of merit and eligibility is conducive to the fact that sometimes people are not offered the same opportunities. And once again, we are reducing this universality. And since the 90s, well, especially I'd say that this is something that has been in Sweden, they've reduced the level of expenditure in terms of the public support or care that is offered to elderly people. And it's focused on some very, very specific profiles, people that have much more intensive and complex needs. And it's not only that, but as I mentioned before, as it's a decentralized service and as they have a very high degree of autonomy, each town council can establish its own management model and its own goals. So this has produced inequality as regards accessibility in different municipalities. And as Iria pointed out, when I looked into the home care service, I analysed 9 municipalities, and there were inequalities in terms of access to the services and how people were using them as a function of the conditions under which one service or another was offered, what people could either use them or not. So this obviously had an influence on the experience that people had in each municipality. But when we mentioned before that there's been a very specific focus in Sweden, for instance, there's a law that says that part of the tax has to be spent on hiring home care. But no specific collectives are mentioned, like users, for instance. And, well, it's very clear that most of the users are the elderly people. And this service is offered as a supplementary service. So here what we can see how the public service the public service is somewhat restricted, and you move on to the privatization option, and the same thing happens at nursing homes or something similar. And even though there are less beds available since the 90s, there's been a deinstitutionalization process, and nursing homes are offering less beds, less rooms, and the cost has increased. And it's becoming more and more difficult to have a room in a nursing home. And the people, when they are sent to a nursing home, they are in a very severe situation and they die very quickly. So we need to understand the needs. We need to understand what the well-being concept means. I think that nowadays we're using the concept of what some people call a significant life, because before I was mentioning that some authors already pointed out that this care has to address health conditions. In other words, we don't really focus enough on emotions, which also poses a risk, because you could end up leading a very lonely life. But I think that as regards the social services, we are still limiting ourselves. We're just meeting the most basic needs of people, but we are not really improving the lives of individuals in a significant manner. But I think that I've only mentioned half of the things that I was supposed to be talking about here this morning or this afternoon. Okay, well, I'm going to move directly on to the final point then. And that is, public providers have to offer care. And this is something that has to be discussed, of course, but I think that it's very interesting to see that these authors that I mentioned previously already said that the incidence or the contribution made by these private carers in terms of de-universalization mean that the people participating in this process feel as if they were excluded, or sometimes not. But this also shows that as a function of the regulations to be approved, there will be an X degree of engagement. We'll have to see if those participants do have a profit-making motive. We'll have to see if the contracts are sufficiently competitive, or if this is based on other kinds of collective agreements for people to be hired. But I think that in the case of Maitelan, it's been pointed out. In other words, what we have to do is receive more support from the institutions and change how things are being done. And we have to see if those private providers can offer supplementary services, because in Sweden to date, these private providers can offer supplementary services, which I think is producing inequalities. And I'd also say that nowadays, many times, people are saying that you need to have the right to decide. Well, that's a very interesting concept, because the person, the user is then treated in a subjective manner. And we have to, in other words, these are subjects that can decide what they actually want. But many a time, for instance, in Stockholm, they can choose their providers, but they have 130 to choose from. It's true that they appear on a website, but families don't know how to choose the right provider. So a question arises, what do we want that right to decide for if we are completely lost? I prefer it to be only one public provider. But in any case, we should have another kind of right to decide. In other words, resilience, working hours, frequency, being able to choose between quality indicators to end up saying that the decentralization process is good to meet local needs. But it would be interesting to establish indicators that ensure equality in the way people are treated. And we'd have to see if this system does it really guarantee equality, and are local requirements being met, or are we increasing the social inequalities? And I'll finish here. Thank you.
That is the question. Thank you very much, Anne. Thank you all very much. I'm really very excited. I think that you've done an incredible job, that the presentations have been extremely interesting and necessary. These presentations should be given at all schools, in all areas. I think Irune said that we have to start at schools to talk about care. We have to have a sort of education on care. And I'll shut up because otherwise I'll give a fifth presentation and we don't have time. So I'll now hand over to the audience if anybody has any questions or would like to contribute any ideas. We have one hand up over there. And the speakers, if you've left anything out, and I know you have, can also take this opportunity. Hello, good morning. First of all, I would like to say thank you. During this panel and during the first panel, we've heard some very interesting ideas and thoughts. And as a representative of the ELA trade union, and a lot has been said about the working conditions of carers and the various experiences. So briefly, I'd like to say the following. There are some experiences underway in Gipuzkoa that I would like to mention because I work in Gipuzkoa. For example, in the case of home care services, as mentioned in these last few presentations, there isn't a provincial bargaining agreement. The terms are up to the town councils, they're decentralized, and we found that working conditions are very precarious. There are part-time contracts, an incredible low wage gap, and in recent years, especially in the last 7 or 8 years, we've tried to organize the workers in the various municipalities and to empower the workers that are mostly migrant workers, and we've been able to sign 23 or 24 agreements where there have been improvements in working conditions and in the salary. It's been raised by approximately 30%, and some limits have also been established, or at least we've tried, because of course in the care sector, and now in the case of the day centers and homes, which is what I'm going to talk about, we find that there have been a lot of struggles over the last year, and a number of agreements have been signed, but the employers have tried to find a different path, and they've resorted to part-time hiring. At the homes and day centers in Gipuzkoa, some 5,000 people work, and practically half have a part-time contract. What does this mean? Well, the working conditions are more precarious, and also the worker becomes a vulnerable person, and the institutions look the other way. So here it can be said that both yesterday and the day before yesterday, the staff at the homes were on their 15th and 16th days of strike, and some centres have been on strike for 75 days. And on the one hand, they're asking for a 100% contract, a full-time contract, because part-time contracts only justify the aim for profit for the companies, because until recently it wasn't possible to justify part-time contracts. And secondly, they want to do away with the pay gap, because the difference per year is about 10,000 euros between public workers and private workers. It's incredible. And I wanted to point this out because I think that the trade union movement can also help. We're vindicating this decent care system, and we're also making a contribution to feminism, because we believe we're empowering women that work in this sector. And there have been feminist strikes On March 17th, there's going to be another strike on minimum wage. And meanwhile, we'll continue to organize the working class and to make these contributions. Hello, my name is Julio, and like Ancha, I come from the ELA trade union, and I'm responsible for Vizcaya. And a couple of points from me. First of all, if we look to the future, in the case of people with functional diversity, there are no services provided. And these people come to the current homes. But how can we work to fight against psychosocial risk? Because it's always said that mental health is very important. But what elements do we have, even from a political point of view, for all this? On the one hand, in Vizcaya, we have a campaign underway, When You Get Sick, Caring, and it covers three main aspects that generate a psychosocial risk. The work pace, among others, and we also discuss how work is organized. And I think that we all face a major challenge in that area. Thank you very much. Thanks to the people representing the ELA trade union. And these are the people that are missing on the panel, although there's a lot of people missing, because we're all involved in this. We're going to continue to work, and we can count on these guests to be included as speakers at the next meeting. Good morning. Just a clarification for Anne. The tax system in Sweden, well, I have no idea, and I was just thinking about it. These concepts of care and so on, are the taxes collected by the town councils, or is it part of the general tax system? In other words, do the town councils have specific budgets? Do they collect the taxes in order to be able to manage care? Yes, I just don't know. I don't know about the subject. Well, I couldn't tell you exactly, but in Sweden, when they pay their taxes, they pay them separately. Part of the taxes go to the town council, and part of them go to the district. And most of the tax is paid to the town councils. So the town councils usually have a big budget, and they usually have the most important competencies. So that's how they work. I have a question for ZainSare. Perhaps you can explain. What is the role of Udaltelektik? Does the town council monitor the working conditions? Because that's key to guarantee proper compliance with rights and obligations. Do they monitor the actual conditions of domestic employees? If you have any competencies to be sort of a good cop and monitor that. And then regarding the situation of foreign workers, do you also work on the regulations? Because legal advice and training is super important. But there are a lot of colleagues that are here for the minimum time required, although there are other regulation pathways. But even so, their irregular situation is perpetuated, and therefore their inequality continues. So how do you work on that? Just a second, Jasone. Just a brief comment. This is going to be the last question. This is going to be the last answer. Because at 2 o'clock we have to finish. Because that's the end of the interpreters' workday and we have to respect that as well. It's true that on the one hand, there is a kind of monitoring, but of course, how can we know whether those women that are live-in employees, most of them are women, how can we know whether they're well looked after and what their situation is? We started up this program recently in September, and we're taking things step by step. This kind of situation has been referred to us from social services, and the social workers monitor it, but it's not easy. But we try to do it. In this space, we have the intention of guaranteeing what she was saying. In other words, that the carers are working under decent and safe conditions. That's one of the goals of this space. And on the other hand, we have this issue of the regularization. When we started, I brought this up because personally, I believe that on the one hand, when we talk about dignity, we're not just talking about the number of working hours and the salary. People's dignity has also been based on their dreams, their expectations in life, where they come from, where they want to work, and depending on the talent they have to make it available to others. That's also dignity. And for that, regularization is indispensable. So that will be another aspect we'll be covering. But as I said before, I think that all this reflects that there are many different aspects. The women carers, the situations we see every day, assaults, etc. And then we also have the dignity of those people with regard to their life expectations. Well, with this final comment, we can close today's meeting. Thank you very much, Jesse, Jasone, Elisa, Anne, Iria, for the coordination and chairing. Thanks very much to Kathleen Lynch, Kathleen Matman, Nina, John, Jesse, Tina Rosgard, for your participation. We feel that the analysis, the points of views and reflections that have been brought up here are useful to continue with our reflections and to continue to learn about care-related issues and to look forward in order to improve the situation in the future. And also to clarify the doubts and queries that we still have, as we've seen in these final comments. As Jasone said during her intervention, all the information that has been presented here, the documentation is something that we'll work with and will make it available to everyone that needs it in order to carry out a real transformation of the care system. But in any case, I think that at this meeting we've taken significant steps, and I hope that it will continue to be fruitful for all of us. And thanks very much to everyone that has participated, the organisers, the coordinators, the foundations. Have a good weekend and see you next time.